Peace and greetings to you. This is Dr. O, the PA Pro, otherwise known as Omar Abdul Malik. Okay, tonight I will talk about how to become a clinician or a physician assistant specifically. But for those of you all who are interested in a career in medicine and other aspects of the allied health, I'll give you all this advice. And this is good advice that will last you and help you in other aspects of your life outside of the medical field, and that is to control your anger. I'll give you an example because I snapped at somebody tonight, or I guess technically it's yesterday because now it's 12 o'clock in the morning. But there was a patient who had really tried my patience and the patience of my colleagues, and I saw the CEO of our hospital, and I didn't even greet him. I didn't say, "Hey, good evening, sir. How are you?" I just said, "Look, you got to do something about this." And I had to apologize to him later because my I was very abrupt and rude, which I try not to do. But I had let my anger kind of get the best of me, my anger toward this situation that was outside of my control, and I wanted it controlled right then and there, to my specifications. And it really showed me that I was not as mature as I would like to think that I am, and not as in control of myself as I would like to think that I am. If you can control your anger, man, you can do incredibly great things in this life. Now, I'm known for being a pretty reserved, calm person, and I have to be. That's kind of my nature anyway. But as one of the leaders in the clinical leaders here, or somebody who's at least seen as a clinical leader, I know that in many instances I kind of set the tone. So if we have a lot of emergencies, before I got off, there was something called a rapid response, and it was in the nursing home. So I had to go assess this patient, find out why the rapid response was called. Okay, let's send the patient to the emergency room. I had to stay calm. I couldn't be doing a lot of screaming and hollering. And when the I guess the transport people got there, just give them kind of information on the patient. One of them was kind of like asking questions like, well, why this, why that, why? I said, okay, let me just stay calm. Say, well, this is why I feel that this patient needs to go out to the hospital. If they were on a different unit, we would put them in the ICU. Well, how come? Well, why? What? Look, I know I wanted to say, look, just do what I tell you to do. But that wouldn't have been appropriate. So I guess in summary, control your anger, think before you speak, certainly think before you act. I have, I take care of a lot of guys in the inner city here, and they were into what one guy told me was banging, kind of thug life, for those of you all that remember Tupac Shakur. So some of these guys are guys who have been shot, stabbed, been in and out of jail, so that they're kind of from the streets. So I got to be able to relate with them, and some of the idiosyncrasies that come with a certain behavior, without going there myself, quote unquote. Just because the person curses out, may curse me out or curse the staff out, I can't respond in kind. I may want to on some level, but it would be unprofessional of me, and it doesn't set a good example, for the patient or for the staff. Now, it doesn't mean that you let people walk all over you. You have the right to defend yourself, but again, just, if you're going to be a doctor or a nurse practitioner or a nurse or a physician assistant, understand that people are going to look to you for leadership. And that leadership really is I guess the efficacy of your leadership is often determined by how you're perceived. Is this person unflappable in, emergency situations or emergent situations? So strive to be like that. For those of you all that are trying to get into programs, I can tell you, when you're doing your rotations, like your surgical rotation or your internal medicine rotation or ER rotation, man, you're gonna have that one chief resident that's gonna just haze the heck out of you. Tell me about this patient. How long has this patient been here? How many days has this patient been on Zosyn? You don't know that? Why don't you know that? Yeah, you stink. You're the worst student ever. And you got to take it. I mean, you can't stand there in the middle of the hall and be arguing with your chief resident, or certainly not the attending. You're not going to finish your rotation, and you may possibly get kicked out of school. I found that out the hard way. Almost. But that'll be a subject of another video, maybe. But, you have to have extreme control over your character. And unfortunately, I think in this past election even, we saw the antithesis of that, which is say whatever you want to say. Call people names on both sides. Call people names. Use whatever type of language you want to use. You can't do that. That's not the sign of a good leader. And that's not the sign of self-discipline. So in summary, try to control your temper, control your anger and your emotions, control what comes out of your mouth. Don't gossip, don't backbite, don't use bad language. It's a sign of maturity and in somebody who's I think a more refined person, which is what we're supposed to be. If you're going to be in this field, do it justice and do yourself justice and those around you justice. But if you have an interest in the medical field and think that you'd like to become a physician assistant or a health education specialist like myself, please subscribe to my channel. I also interview people in different aspects of the allied health. I owe one of you all at least a interview with a clinical laboratory scientist, so I haven't forgotten about that. But I wish you all peace, and stay tuned for more videos. Take care. Peace.